Welcome. Good evening, everyone. Thank you for joining us tonight. For this is makes our fifth Zoom panel discussion in a series that we've entitled COVID-19 Community Education Series. And it's being brought to us by Mr. Ravi Shakamuri and Star Hospice. This has been going on for several weeks now, and it's designed to basically kind of offer a glimpse into the ins and outs of this pandemic and its effect on all of us, and to hear from local doctors and healthcare professionals such as those joining us tonight. So greetings, my name is Pat Canty. My day job is as publisher of the Odessa American, and my evening job is helping Ravi and getting to visit with these wonderful healthcare professionals to help educate more of you in the public. So what we're going to do tonight, and it's kind of a great way to wrap up the year in this series, is to really talk to the frontline kind of warriors or heroes, as you may, in this fight in the local level. These are our nurses, our respiratory therapists, our occupational therapists that day in and day out have been helping men and women get better, trying to save lives in this pandemic. And the stories they have to tell they're simply amazing, and these are amazing people. And so what I'd like to do tonight is first introduce our guest panel, and then we'll jump in and hear some more about their stories. First off, I'd like to introduce Denae Sims, and Denae is the CCU-COVID director at Odessa Regional Medical Center. Denae graduated from Midland College in 2007. She got her registered nursing license, and she's also a critical care registered nurse. After graduating, she worked in the CCU at Midland Memorial Hospital from 2006 through mid-2015, correct, Denae? And then
Yes.
From there, you moved over to ORMC and have been in their critical care unit ever since. And you took over director there of that unit in October. So welcome, Denae. We're glad you're here tonight. Next, we have Marshella Garcia, and Marshella is a registered respiratory therapist. She graduated from Odessa College in 2001 with an associate's in applied science in respiratory therapy. While attending Odessa College, she worked as a student at Medical Center Hospital and continued there after graduation in 2003. Now she's currently employed at Odessa Regional Medical Center as well. So we're glad you're here as well, Marcella.
Thank you.
Next, we have Jay Foote. Jay is an occupational therapist. She's been one for 19 years, graduated from the Texas Tech Health Sciences Center in Lubbock, and has worked as a therapist in several different settings, ranging from home health, skilled nursing facilities, long-term acute care hospital, inpatient rehab, and acute care. For the last 16 years, he's done mainly inpatient rehab and acute care. And he's also been at Odessa Regional Medical Center. I think you're going on 12 years, correct, Jay?
Yes, sir.
For 12 years. Welcome. We're glad you're here.
Thank you.
Next is Heather Burkhalter, and she's a registered nurse at Medical Center Hospital in their critical care ICU area. She's been caring for critical care COVID patients for quite some time now. She's been practicing nursing for 9 years and has been employed for Medical Center Hospital for 10 years. Born and raised in Odessa, a graduate of Permian High School, she received her degree also from Odessa College. She's a relief charge nurse in the critical care unit and is currently the charge nurse overseeing the critical care overflow unit at the Wheatley Stewart Pavilion over at Medical Center. I'm glad you're here, Heather.
Thank you.
And then we have an interesting guest, Andrea Gillespie. Andrea is currently living in Odessa, and she's working at ORMC as a registered respiratory therapist and a licensed respiratory care practitioner. But Andrea is interesting because she's kind of a traveling nurse. She worked for some time at the Rady Children's Hospital in San Diego. More interestingly, she was one of these nurses that made the trip out to New York city in the early days of the pandemic when it was running rampant throughout New York City, and they were desperate for healthcare workers to come to the city to help deal with the overload. And so Andrea was there helping in New York, and she was there for several months, and she's currently now back. She's helping out at Odessa Regional. She's a licensed respiratory care practitioner in the state of Texas, California, and New York. She's also a sleep disorder specialist with a degree in respiratory therapy and a degree in home health sciences, professional development, and advanced patient care. She's been working in intensive care, sleep care medicine for 10 years now. So we're so glad to have you here as well, Andrea.
Thank you. Thank you. Glad to be here.
I think what we'll do is to kind of kick this off, and it's a question I kind of posed to the previous panelist is tell us about your everyday life, your daily routine in the jobs that you have at the respective hospitals, and help us understand what it's like during this pandemic juxtaposed to what it was like before then, because I know it must be drastically different. So why don't we kick it off with you, Heather?
Okay. Well, it takes a lot longer to get into a room with all the PPE that we have to put on before going in, which changes things up quite a bit. Supplies being in the room, not so much anymore. We have to kind of get everything ready outside of the room prior to going in. And you really have to make sure that you have everything you need so that you can be efficient with your time and also decrease your exposure, how many times you're in the room. Mm-hmm. Also, not seeing family at the bedside, they can be a huge help when the patient is not able to do things for themselves or you have questions. But because of COVID, they're not at the bedside anymore. So that changes up a lot for us too. And for the patient not having that support with them.
Right. That's a big issue. Jay, what about you? How does your day compare now to pre-pandemic?
A lot of the same. I mean, as far as just everything you have to go through just to get ready to see a patient. I see patients on both sides, COVID unit and not in the COVID unit. So, you got to go change out of one pair of scrubs into another pair, see your patient, change back out of your scrubs, go to back over, across the way, and you're trying to juggle both, but it's just kind of, initially for me, it was very overwhelming. You kind of get in a routine, you kind of get it down, but early on, it was a big adjustment to get used to just everything you had to go through to go see a patient over there. And I would agree with Heather in that just for the patient, even on the non-COVID side, their families aren't by them either, just because of the restrictions that the hospitals had to take to try to prevent the spread of it. You get a lot of information from the patient's families, and then also the toll it takes on the patient, because they're going through, whether it's COVID or not, they're sick and going through their worst times, and the people that are closest to them, they're not there. So it's a big adjustment, and initially it was very overwhelming and took some getting used to, and it's not something you get used to. It's still hard. It's a little bit easier because you get in a routine, but it's still very difficult to, and I'm just over there I'm a therapist, so I'm in and out. So I get tired of all the PPE for the couple of hours I spend in there, and then I look at these nurses and respiratory therapists that are there for, 12-hour shifts. So much kudos to them too, and the respect I have for the work they're doing.
That's a good point. Andrea, what about you? What's it been like?
Well, for one, definitely takes a lot longer to get ready to go over to the COVID unit. Reports are longer. The breakdown that we've gotten from wearing the PPE, I know it's hard wearing a mask for the general public, but a lot of our faces have broken down because we're in these masks for hours, 12 plus 13 hours. the shifts do vary because, you know, a lot of our patients are unstable. So we would normally work 12 hours, you know, sometimes you're there for 13 plus hours because you want to stay and help as much as you can. And just the whole workload is different. I know a lot of us are working more than what we normally work. You know, everyone's trying to help as much as they can. So it's definitely a huge difference from our normal hustle and bustle of the hospital to where we're at, you know, with this pandemic. So those are the main changes for me.
Thank you. Denae?
Well, it has given, you know, the term bad day new meaning. You know, used to a bad shift, it was bad, but when we had the first surge, like it was nothing to compare it to. Even with having years of experience, it was the craziest thing I'd ever seen. It was overwhelming. It was emotional, limited resources at times, limited help. And you're just trying to, you're doing your best to keep people alive.
Yeah.
And then also like support your teammates, keep each other going. I'll say that there's a lot more camaraderie, I feel like, in my unit now. Like we've really grown close. There's no more day shift and night shift divide. We're all in it together. And the amount of care that these patients require it's a lot of hours, supplies. They have a lot of new things we had never, you know, encountered before. But my day-to-day routine has also changed because of a new position. And so I think I ended, my last shift was late September. I worked nights for 13, 14 years, and I took a day off, and then I trained for a couple weeks for the role I'm in now, and then we surged again. And so, you know, we went from 1 unit to 2, but now I have 3 areas. And my job is just now I'm there to support the staff, to support patients, to help with the families. If I'm needed on the floor, I'm there. Our units are in 2 different buildings, so I'm back and forth all day. But they're the nurses, the respiratory therapists, the doctors. They're all my heroes. They work so hard. And I see that a lot more now, like standing back and seeing what all they do.
What about you, Marcella? How's it changed for you?
Oh, it's changed tremendously. I remember when we first got our first COVID unit patient, and it was like 1 or 2. And from what it was, from 1 to 2 patients to being full to capacity, we wouldn't have many ventilator patients. Now there's up to 9, 10, 11 vent patients. It just can be overwhelming. And I'm so grateful for the FEMA staff that came in to help, because I don't know what we would have done without them. And it's just terrible just to see all the patients there without their family there. And then when you see them on the phone, talking to them, the ones that can talk, it's just heartbreaking. It's just terrible. I mean, they can't be by their side. They have nobody. They have us, you know, we try to do the best that we can, but it's just really hard.
The doctors have said that too, that they find one of the most frustrating things is the fact that you don't have that family there, and they really do help you make decisions, and they really are part of the process, a critical part. And it's got to be hard. You know, Jay, I didn't, maybe I've been asleep, but I didn't realize that it wasn't just COVID patients. Families can't really go in. It's family members for other patients. And that's just got to be so kind of, the anxiety levels just got to be terrible.
And you don't
And if I
realize what all family members do bring to the table in terms of, we get these patients that come in from ER or from another county and they're on the ventilator, or, of course, these patients are on extreme amounts of oxygen, higher than we've ever seen. And they can't tell you, they can't breathe. They can't tell you their home medications, their history, their surgeries. And those are things that you really need, to make sure that we're taking proper care of patients and that we do get those things resumed. And families do bring a lot to the table. And I will say that it made me appreciate them more.
Good point. Andrea, you were going to mention something too?
I was just going to say that I just wanted to take a moment to thank Denae. Denae has really stepped up in the short amount of time that she's had to transition to her role, and she's been amazing. And that's just, for directors and our administrative staff, sometimes they don't get the recognition that they deserve because they play a tremendous role in keeping everything together. So I think that's kind of important to bring to the forefront and mention, as well as just the people that do the clinical work. So thank you, Denae, so much. We appreciate you and love all that you've done.
Well, thank you. You're going to make me cry.
You started your new position in October, right? And it wasn't that kind of when we were headed into the...
So while I was training, we were down to 2 COVID patients. We still had our regular CCU and then our COVID area, and we were down to 2 patients. And within, I think the next week, some more trickled in, and the next week more. And then and then my first week, I want to say we had to open up another area. So it just exploded.
Yeah.
But thank you, Andrea. That is so sweet of you.
So Jay, you mentioned, and I kind of, what it was, the early days when it was first starting and how it was, I guess it was pretty scary and overwhelming. Maybe y'all could tell us more about that. Help us understand kind of where y'all were at when on the early days. I mean, what were the kinds of things that worried you? What were the early challenges, supplies, or, just not knowing what the virus was, how virulent it was. Help us understand kind of those early days. And then, yes, you've gotten into more of a routine now, but I think there's also been some developments along the way that have helped. So maybe y'all could kind of help us with that.
Worrying that you're going to take it home to your small child or your elderly family member. I mean, and not really knowing exactly who might die from it or if you're even going to get sick. And we're already so short staffed, worrying about having to leave your other team members short,
That's a good point.
Mm-hmm. I think from my perspective, I wasn't here in Odessa when you guys hit your main surge, but from being in New York, it was the not knowing, that factor, not knowing what we were walking into at that time, because there's very limited information on COVID, the way it's transmitted, what it does to a patient. So I walked in there thinking I knew one thing and getting there and realizing that we don't know. So I think that was the scariest part for me, is the not knowing and going there and seeing that this is nothing I've ever dealt with before professionally. So that's my perspective on it.
Just unknowns.
Yes. Same for me, not knowing and just wondering, using all that PPE, is it still going to protect me? Am I going to be bringing this home to my family? But I mean, I've been in there since March and I've been fine, thank God. So, masks, everything, washing hands, sanitizing, that does work.
So one of you mentioned FEMA. FEMA has people here helping out at the hospitals, I guess. So Andrea, you're kind of one of those kind of to the rescue type of people when you showed up in New York way back when. tell us what you were doing at the time that you made the decision to go out. Where were you? Why you made that decision, and kind of just lead us through that whole ordeal.
Well, I was in California. I was working at a children's hospital, and at that time, California wasn't really bad. We had maybe a few COVID cases, and they were in that 99% that were affected tremendously by it. You know, they're able to go home to their family. So I kept seeing on the news that, you know, New York was getting worse. They had tens of thousands of people dying each week. And my hospital was so slow that they were sending home our travelers, and they were sending staff home early. So at that point, I was like, well, I have the skill set. I know it's really needed right now, and I would really like to go and help if I can. So I made the call. I was contacted within 24 hours, and I was on a flight within a week to New York.
And what was it like when you showed up, when you arrived? What struck you the most?
When I got to New York, I mean, if anyone's seen New York, no matter where you're from in the world, you're used to the hustle and bustle, the business of it, seeing people all up and down the streets. And when I got there, there wasn't a single soul on the street. It was so quiet that I couldn't believe that this was New York. I know every night when we would go into the hospital, the people that lived, I was in Queens at Elmhurst, which was the worst hospital at the time. All the people that lived there, they would open up their windows and they would cheer for the healthcare workers at 7 a.m. and 7 p.m. And, you know, it really gave you that boost of energy that you needed to go in and work that night. Because when my first shift, I felt like I was going to pass out. I just was extremely overwhelmed with the amount of patients that we were receiving, but everyone came together. We were helping each other, and I thought it was such a beautiful thing to see people come together the way they did in New York, how supportive just the citizens were, and how they did everything they needed to do to get their numbers down, and which they eventually did.
How did it change you?
It changed me because I know people have this argument that when you go into any type of medical profession that you go in to help people, but I think I can speak for most of us when I say that none of us ever expected that we would live or have a career through something like this, through this pandemic. It's definitely opened my eyes to how short life is, like a couple of us were mentioning the fact that people cannot have their family members there, and to how important of a role everyone inside the whole healthcare community plays, everyone even down to environmental services. Everyone had a role to play, and I think it just brings light to how everyone's important, from administrative staff to nutrition to occupational therapy, physical therapy, and to the people that work directly in the COVID unit. We all made it happen for the patient. Mm-hmm. So I think that was a light bulb that went off in my head, how important every single person was to the patient's overall care.
I think a lot of people also, they don't realize necessarily all the time that you put your lives on the line. And I know, Denae, y'all had a colleague that y'all lost not too long ago, who was doing just that, helping the sick with COVID. And maybe you can tell us more about Jamie.
So Jamie Lozano, he was an RT there at Odessa Regional Medical Center. He actually was an RT for over 30 years. He worked, I think he started off at Middle Memorial and then went to Medical Center and then came and stayed for quite a while at Odessa Regional. I believe he was also working in Andrews. But I mean, death is hard. We see a lot of death right now with COVID. It never gets easier, but when it hits one of your own, it's different. Especially somebody that dedicated their life and their career, to taking care of patients, to being a mentor, to teaching. One of the best RTs that I've ever worked with. He was always there for us. Even if he thought you were a little sad, he would sit down with you. I worked nights with him for 6 years, and he was my coffee bud. We'd always make each other pots of coffee. But it was very hard losing him. And I actually ended up working the night that we did lose him. And it's not about me, but it killed me. And then when you see in COVID patients the progression, you know what's about to happen. They go from a nasal cannula to CPAP, BiPAP, and eventually they'll end up intubated. And it was very hard watching him go through that. And nobody deserves to die. Nobody deserves to get COVID and be this sick. But then when it hits somebody that dedicated themselves to even taking care of these COVID patients, it's really hard.
He's working right up.
He's a wonderful. Yes, he worked right up until he got sick. Wonderful person, would give you the shirt off his back, was so kind to the patients, was so skilled. Wonderful to his family, always talked about his family, loved them very, very much. Mm-hmm. So it's not fair. None of it is fair, though.
Right.
So
if I can add to that, I haven't been here as long and worked with him as much as some of the other people have, but I can say from day one, Lozano was just an amazing light of energy. He's one of those people that you just couldn't forget. He made me feel so welcome. He was always there when you needed him, and this was a tremendous loss for Odessa Regional Medical Center, and even more so for his family. I want to send my heartfelt condolences to the Lozano family, and just thank you so much for letting us have him, and for us being able to experience the person that he was. Thank you so much.
Thanks. It's I think one thing it underscores that it could strike anyone. Yeah. And I'd love to hear some of the stories that maybe y'all have heard from the patients that you worked with about, did they ever think they would, do they know how they got it, or do they, tell me some stories like that. Have you heard of, from your patients how they contracted it?
Well, we have, cases where we have family members in our ICUs, mother and son, husband and wife, and it's really, really, it's sad to see anyone die, but when you see a whole family just about taken out from COVID, I mean, you're going from one family member to the next. You're calling the family member and telling them that it's imminent for one, and then a few hours later, you're having to call them and tell them that their next family member is passing too. I think that's really, really hard on us, because we try to do everything that we can, and I just hope that the general public knows that we're in there working as hard as we can, and we're doing everything we can for their family members. And I've seen it. I see everyone go above and beyond for these patients. And we kind of had that in New York, I know from the public, they were kind of worried about not being there and seeing their family members and being able to advocate for them. But I can say from my experience and working in multiple places that these healthcare professionals are advocating for your family members, and they're doing everything they can while they're in there. So I just want to make that note and just let the public know that we do care for these people deeply, and we feel as if they're our own family members, and we're doing everything we can.
So having to see all that pain, I guess, does it really make you upset when you hear of people that say, oh, this is not that big a deal, I'm not going to wear a mask? How does that make you feel?
Very upset. There are days where I couldn't even get on social media because I didn't want to see comments. And I'm not gonna lie, it's, even some of my family members even may, feel like it's not real, or masks are stupid, or but this is not political. This isn't about somebody taking away your rights. I think if y'all saw what we saw, you'd feel different. And I know you hear, like you were saying earlier, Pat, it's less than 1% death. Not from where we're looking, not on our end. We went from having maybe 5 deaths a month to triple that maybe in a week.
Right.
Time period. And is never okay for, it's never okay when a family member they're going through the loss of somebody. Why is it okay for these people to die? How is that not real? Us saying, wear your mask, please take care of yourself, please wash your hands. We don't want you to get it. We don't want your families to get it. We don't want you to die, because we know what COVID is. We've learned a lot about it, but there is no definitive treatment for it. Mm-hmm. It's either you're going to make it or you're not. And that's even with the very, very best of care. So we just want it to stop.
Yeah.
And I've seen like all ages. It's not just, the elderly. I've seen up to 20s, 30s, 40s, all different ages. So it's not just the elderly or somebody with the immunocompromised situation. It just can get anybody.
And we need to also humanize numbers. I hear so many people saying over 300,000 people have passed, but the 300,000 individual people that have lost their life and their family members are left to deal with that grief. Even if it hasn't affected you directly, there are people being affected by it, not only our patients, but their family members too. And that's another aspect we have to deal with when we see their family members breaking down. That bothers us. I know that bothers me when we're there consoling them. And there's nothing you can say in that moment to make them feel better. But that's our reality almost every single night. So we really do need to remember that these are people that we lost, and we do need to do our part. I know it's hard to wear these masks, and we get it. We wear them for 12, 13 hours. We have scars on our face, but we have to buckle down and do what we have to do until we have an effective treatment for it. And to the ones that are doing what they're supposed to do, we thank you and we appreciate you for it.
Yeah, it's I guess Denae, you brought up an interesting point. It's almost like the families that one son goes to A&M and one son goes to UT, and they joke about a house divided. There is I've seen it in families where certain family members don't agree about that it's all that big a deal, and it's a really tough dynamic. I mean,
we try to, because we do get comments, and as the saying goes, we went from healthcare workers went from hero to zero because of what we were trying to portray and ask for, of our communities. We just want everybody to be okay. We want everybody to be safe. Yes, death does happen. Yes, comorbidities don't help the situation, but death, it isn't okay. It isn't okay that these people have died because of this virus. And like some people have lost multiple family members to this.
Right.
And I get it. It's a choice, and people have that choice. But I just hope that if they won't wear a mask for themselves, that they'll do it for people around them, who could get this and could die.
Well, and I think too, Heather, you brought it up earlier. I think the anxiety that someone like you, I mean, you're a charge nurse in the unit where the overflow is going. I mean, you see how the system can be overrun, but yet you have to worry about, catching it, not only yourself, but your loved ones. And that's got to make you angry.
Oh, yeah. I mean, especially when someone just outright tries to deny that it's even a real thing or it's not that bad. It's just upsetting, because if somebody could see what we see in the Wheatley Stewart Pavilion, and you see all those bays full, every patient is on a vent, most of them are not going to make it out of there. And not because we're not busting our butts trying every single thing we can do to try to get them better, but because of COVID. I mean, it takes out the lungs. They can't be ventilated at some point. Their kidneys are shot, their liver is gone, and there's not anything we can do with everything that we're doing. And so it's depressing. It's upsetting to have to see families go through that. I mean, it's real. It's very real.
Where do you see yourselves? We're almost a year into this. Where do you see yourselves emotionally? You yourselves and maybe your team members too. Have you kind of hit a plateau, or do you feel you're sliding? Do you feel better, worse? Tell us, help us understand where you are emotionally.
I feel like it's emotionally tolling. I think most people would agree with that. Physically tolling too, but the emotional toll that it takes on you, you're hearing these families on FaceTime and they're crying.
Yeah.
You can't get away from that. You can't separate yourself from that. But also, I mean, we're human. We feel for them. Like, it is so sad. It's very heartbreaking to know that they can't be with their loved one, and that they can't help in any way,
Right.
It's very sad.
I would say most healthcare workers are emotionally and mentally spent. A lot of them, we go in every single day and we have to deal with this, like Heather was saying, not only physically, but the mental and emotional aspect. And eventually it takes a toll on you. I think we're all still trying to do what we can to help these patients, but that is something that we do need to make sure we're doing, is taking care of ourselves mentally and emotionally. And I hope everyone's doing that and practicing self-care, although it's kind of hard right now. I get it, but it's very, very challenging for the majority of us. And I know it is for me.
I would use the word kind of broken. And like Pat, you had mentioned your patience is gone. We're grumpy, we're tired, we're in some ways we're defeated a lot of days, but doing our best to come in and start over and start fresh and smile each day. But I would say that we are all different people than what we started. Right. Like your tolerance for things is totally different. It's way down.
But also in the same vein, do you feel like maybe you've discovered that you're a lot stronger than you ever gave yourself credit for, Jay? I mean, you've been able, you're drained, you're down, but you're still in there making a difference.
Yeah, I mean, yeah, it's very draining. I think it was just before the holidays, you know, I talked to my wife and my family, and I said, I don't think I've ever been this burnt out, just tired.
Mhm.
And, you know, it's a roller coaster from where, you know, people initially told me, like, why is therapy and why do you have to go in there? And these patients are there for so long because you don't know they're in there for months at a time. They get off a vent, they can't even feed themselves, they're so weak they can't even sit up on the edge of the bed. So we come in there to do therapy, to get them
Right.
up. You know, they might stand by the bed and their O2 sats drop to 75 just standing there. It's every day. And then it's draining too, because you have a patient because in our unit, we have kind of the COVID kind of CCU unit, and then we have a hallway where they move, where they get a little bit better. And it's just one day you walk in and they're doing better, they move to the other floor, and then for whatever reason,
Right.
it's all over the place. It's a roller coaster, and just, you know, it is draining. And again, I'm just a small part of I'm not there the whole shift, but it is draining. But, you know, it's, for me personally, I feel like it's what I've called to do. God's put me here for a reason. And, you know, we do what we're supposed to do. And it's a team. It takes all of us, you know, and we press on and keep working and hoping to, you know, see a light at the end of the tunnel, and it'll get a little bit better every day and see our numbers go down. So I don't know if any of that makes sense or answers what your question.
No, it's spot on. And speaking of, you know, why you do what you do, so Marshella, do y'all know Letty Lozano Medina?
Yes.
Okay, she just messaged in. She said, thank you for all the work and commitment you give to the patients. I will forever be grateful. Marshella Garcia, Denise, Troy RT, Natasha R, Pinkston, and everyone that helped me through this COVID, and now I'm home.
Oh, I'm so thankful. Yes, we love you. That was very scary too. She went on the vent, and she was lucky enough, by the grace of God, to get off that and be at home. I'm so happy she made it through.
Now, so speaking of kind of, that's a good story. That's a happy story. And maybe we're headed toward a happy story or a happy ending to this nightmare with the rollout of the vaccine. And I know before we jumped on the call with everyone, we went around the table and y'all all got your vaccines, right? Tell us how you feel now about that. How you felt going in, knowing that after, you know, everyone's waiting for this hopeful, you know, solution, that you had the opportunity to get it. And what's it like? Help us understand that.
Well, for me, I had a lot of anxiety about going because of hearing about the stories. And I was thinking, well, I'm just going to wait for the next round, see what happens to everybody. I mean, it's the truth. That's what I was thinking. I'm not gonna lie, I was scared, but then I just thought, you know what, I'm just gonna go ahead and do it. And I got it done yesterday, so I'll be back in 4 weeks to get my second vaccination. So it's good. You have to, or there's never gonna be any kind of any kind of normalcy again. I mean, whatever that's gonna be, at least hopefully the vaccines are gonna help.
What about the rest of you? That's important to say, Michelle, because I mean, people need to know that healthcare workers, you know, you professionals, you're health professionals, y'all, it's okay to be scared about these things, but you know.
I was terrified. but you know what, if it'll stop this, if it'll stop people from dying, or we can get back to, you know, seeing our families, seeing our friends, getting to be together, getting to do things and see the world again, then I'm for it. Let's do it. And I had probably more anxiety after I got the shot, like, oh my God, what did I just do? But you know what? I didn't die. I'm still here.
Mm-hmm.
I'm ready to get my second one. So I'd say it's worth it.
For me, I had anxiety too about it. I talked to my wife about it. Should I not? Should I? Our hospital is real good. They did a Q&A with 6 experts in the field and answered any and every question we had about it. So that helped ease some of mine when I heard the experts talk about that it is safe. Even one of our nurse practitioners, I'm standing in the COVID unit and I stopped her and I said, hey, what, do we take the shot? Do we not? And she just said, well, everybody's talking about the long-term side effects that we don't know about of the vaccine. But she just kind of held out her hands like this in the middle of the COVID unit. And she said, look at the long-term side effects of COVID, like take the shot, you know? So for me, I did research and listened to people, and even to the point of getting the shot, I was a little anxious about it, but I'm glad I did and look forward to getting my second one. And like Denae and others have said, it's kind of some hope at the light of the end of the tunnel where they can roll it out to the public and we can start being with our loved ones and have some normalcy.
I was very anxious too. But, you know.
Okay, we have 4 anxious.
Oh, super anxious.
No way, we have 3 anxious, 1 really, really scared.
But at the end of the day, it's like what everybody was hoping and praying for. I mean, I know you have a really long ways to go. It's going to take a lot of time for, even when the general public has the vaccine available, for them to get it and for it to make a difference. But if it starts with us and we're on the front line, you know, I'll show everybody I got the vaccine. I'll get my second one. And if this can help cut our numbers down or even get rid of them one day, it's worth it.
Yeah, definitely. I mean, I think, I think I'm glad that y'all are saying this because, like I said earlier, I think it's okay to be nervous about something like this, but I think, you know, the level of rigor that they put into these things in record time, I think probably gives pause for people to feel a little positive about it. So I just wanted to throw another one out there. And this is for you, Jay. I mean, once again, you make a difference in people's lives, even for those that don't make it. Stacy Choate Espinosa, she writes that my dad passed away in July from COVID, and Jay Foote helped him along with Tiffany Robert-Vaut and many other ORMC healthcare workers. I can never thank them enough for all they did to help try and save him. I will never forget them or the sacrifices they make every day. So, and I'll say another thing. So you got the attention of the doctors too. The doctors and our other ones, the doctors were the ones, the physicians and the earlier ones that says, we really need to get the nurses and the therapists in because they're the ones. Dr. Jairam Naidu, he just brought in and said, we as doctors learn from nurses so much. When they say something, we pay attention. They help us so much. Thanks to all for not only helping the patients and the doctors every moment to make the right decisions. And I think that underscores what each of y'all have kind of touched upon, is that y'all really are close teams, aren't you? Although I guess there used to be a little night versus day competition, Denae. That's gone away now?
You'll always see that. You know, and I did nights for a long time, but I feel like that stopped. 'Cause we're all in it together. I would describe working COVID like sometimes working in a war zone.
Yeah.
And you're all you have is each other.
Did any of you ever imagine, could you ever imagine when you entered the career that you chose that you would encounter something like this?
No,
I never
not even for a second. No.
Never in my lifetime. I think we would be going through the pandemic that we're going through now. I never ever imagined this. But like Denae was saying, that we do work so well as a team together. If a person needs a timeout, we're there to help them and cover for them during that time. And I really have grown a family at Odessa Regional, and I'm so grateful for everyone there. And I just love and appreciate everyone there. They've been so wonderful to me.
So do you all ever think you would have developed the level of love for your career and appreciation that you have now had it not been working through this?
No, it's been life changing. It's been the hardest thing of my career, and I feel like most health professionals will tell you that, because you're helpless at times. We've had to, go back and try and learn and figure out things and go back to the drawing board. What can we do different? There are days where if I'm being honest, that you're like, I don't know if I want to do this. Like, this is so bad. It's so draining. It's so defeating. But at the end of the day, like, you just want to be there for those patients. You just want them, you want to see them be successful and live and get out of there.
Exactly.
I would like to thank the travelers and the FEMA nurses, because they're basically making up our staff right now. And
Yes.
it's been amazing. I mean, they don't know each other, they don't know us, and we couldn't do it without them. I mean, for them being brave and to step into charting they're not familiar with, and a place they're not familiar with, and a place they don't know.
Yeah, that's
Thank you.
yeah, I think that really, I mean, because this thing hit the hospitals and it's devastated businesses. And too many people forget, well, hospitals are a business too, and they've been equally devastated. And so y'all are having to do so much more with so much less. And that just underscores how amazing it is that you do what you do.
One of the first things I say, because I tour the state nurses that do come, and like Heather was saying, I have very little core staff, because we went from staffing 1 unit to 3, and we wouldn't make it without state and without agency. And the first question is like, well, where'd y'all come from? Where have you been? So it's been, in tough times, it's been really neat. I've loved to listen to their experiences, where they've been, things that they've tried, things that they've seen. Mm-hmm. So it's I'd say it's brought healthcare workers together.
Great. So we are getting close to the 1 hour mark, and so what I'd kind of like to do to kind of wrap this up is, we're ushering out a really rotten 2020, and hopefully 2021 is going to be a lot better. But kind of wrap up, if you could kind of share some closing thoughts with us as we hopefully are winding our way toward an end of this virus as well. Starting with you, Jay.
I mean, all I can say is I appreciate, this panel, my coworkers, like, I guess with the vaccine, I pray and hope that, it really, everybody can take it and it gets better. But I guess just to love your family, love your coworkers, keep pressing on. It's going to get better. We just have to hang in there, keep loving on each other, loving our patients. Go home, love your kids, love your wife, but it's going to get better. I believe and hope and pray and believe that. So I don't.
Super. What about you, Heather?
I just want to say thank you to everyone because we've all come together in such a really difficult time. I know even my supervisor, especially her and the care coordinators, I know they don't get enough credit for everything they've been doing and all the extra time they've been putting in. And to the families, just know that I know they're not our family, but we love them and we're caring for them and we want them to get better. We're trying everything we can. And I hope that one day we see an end to this.
Thank you. Marshella?
Just wanted to say that, yes, it's not over yet. And hopefully everybody will still continue to try and social distance, wear their masks, groups over 10, because even though, you may not have any symptoms, you may pass it on to your grandmother, your grandfather, your family members. So I just hope everyone just, continues with that because it's still going to be here.
That's right. And I guess continue, even if you do get a vaccine, continue to kind of try to follow the.
Yes.
That's good. Denae, what about you?
I hope and pray that one day this will be over. I don't think it's going to be anytime soon, but I do have hope, and I can tell you that I promise we're doing our part on the inside, taking good care of your family members, and I'm sorry we're not always able to talk to families like we used to, like we should, but we're there, we're taking care of them, and we're doing our part on the inside, so we need help on the outside. Exactly. People doing their part so that we can stop this and stop it for good.
Good point. And then Andrea, what are your closing thoughts that you can share with us for tonight?
I think I want to touch back on what Denae was saying, is that even with the vaccine out, that we need to continue to do our part, maintaining social distancing, wearing our mask, and just continuing to stay strong and be there for each other. And I think that we also need to be just mindful, like a few others were saying, that we may not only affect ourselves, but we have to worry about our family members and other people. And if we're not going to do it for ourselves, let's do it for other people.
Good point. Well said. Well, I think we're kind of going to wrap things up here tonight. And first off, I just would like to thank you so much, not only for agreeing to come here and have these conversations tonight, but the incredible commitment and love that y'all bring to your work. It means a lot. And I think what it really hits home is you talked about the frustration, the family members can't being there, but Heather, when you tell people, and you can see the love that y'all have for your patients, and I know that's got to bring a lot of comfort to a lot of families, and not only that, to a lot of sick people that desperately need that love. So I can't thank you enough for your commitment and your service and all that you do. And with that, I'm going to turn it over to Ravi to wrap things up. Ravi.
Thank you, Pat. First of all, again, on behalf of the panel members and the community, I would like to thank you for leading this discussion to make a connection for our hardworking clinicians to the community we have. And from the community, our heartfelt thanks to all of you for what you do and for all your colleagues in all the hospitals and in the community. So we appreciate everything we do, and we wish you continued good health and strength. And we want to close this year. And in my discussions with Dr. Reddy and Dr. Naidu, the topic came up and Dr. Reddy suggested, how about getting our frontline warriors, as he said, because literally it's a war out there. And we are there for you in the best way we can. But we do want to say thank you. And we, as Pat was saying, we want to close out this year strong. And Odessa is strong. We are strong, and we will push this back. And we look forward to closing this year. Again, thank you all for your time. and sharing your thoughts and your concerns and your strengths. I think that gives a lot of courage to a lot of people out there in the community to go out and deal with this in the proper way. So with that being said, thank you very much. Have a good night and safe trip and safe travels wherever you are with the different places. Pat, thank you, sir.
Thank you. Happy New Year to everyone.
Thank you.
Happy New
Take
Year.
care. Stay well. Bye-bye.
Bye.